Thank you, Chair. And you referred to poor inheritance, but one of those areas that the government did inherit that was in a mess was the NHS, which the national insurance rise is contributing towards. And you spoke about the fact about having to make difficult decisions, but also it's important that you have the funds to pay for services and balancing your budgets. Money raised through this change has been vital in providing the additional funding for the NHS. And since the election, NHS investment has risen by £29 billion a year, helping deliver over 3 million extra appointments and bringing waiting times to a 5-year low. They're going down every month. Now, think about the Londoners that are waiting or have been waiting on those waiting lists, with 15% of Londoners living with long-term health conditions. How is this helping to reduce inequalities in our city?
Well, one of the big issues, anybody who's employed people in the private sector meets with businesses regularly, is the issue of productivity. It's very difficult to be productive when members of your team are off because they're unwell, physically or mentally unwell, waiting for an appointment, waiting to be diagnosed, waiting for treatment. So it's really important to recognise the consequence of 14 years of austerity, whether it's policing, whether it's the health service, whether it's lack of affordable housing, whether it's schooling. And by this investment from the government, record sums in just a year, what we're already seeing is reduced waiting lists, improved treatments, and that will not just improve the quality of life of those individuals and their families, but lead to increased productivity as well. I think the health of the economy is intrinsically linked to the health of individuals in our city, and that's why it's really important that we recognise that the inheritance meant not just the massive deficit, but also lack of investment in infrastructure and in the public sector.